Started so that we can send it out to you. So thank you everybody for joining today's continuing education presentation. My name is Erin Benner and I am an outreach representative for EDCare. And I will have just a couple of housekeeping announcements before we get started. For those of you who are not familiar with EDCare, we offer eating disorder treatment in Denver, Colorado Springs, Kansas City, and Omaha. EDCare is in network with over 35 insurances, including TRICARE and Medicaid, as well as offers free confidential assessments for anyone who wants to pursue treatment or needs a little bit of feedback on what would be a good next step for them. And if you have any questions in more detail about any of our programs, please reach out to me. I'll put my contact information in the chat so that you have that. And then today's presentation is approved by both NVCC and APA to offer one continuing education credit. EDCare maintains the sole responsibility for all aspects of this program and its content. To receive the credit, you must attend the full live webinar. And at the end of the webinar, an evaluation will pop up on your screen. Please fill this out and make sure that on this evaluation, you indicate whether or not you need a continuing education certificate. We'll process these and send them out to you within about a week via email. And this webinar will be recorded and emailed to everybody who registered for the event, whether you're watching it live or after the fact. We'll have those to you by early next week. And we will also save about 15 minutes at the end of this presentation for questions. You can use the Q&A function at the bottom of your screen. If you should be the bottom middle, two little chat bubbles, Q&A. So put your questions in there and we will do our best to get to as many of the questions as we can. And lastly, I also wanted to let you know about our next continuing education event that comes up in July. July 16th, we'll have Dr. Tamara Pryor presenting on temperament-based treatment of eating disorders. So I will add the registration for that event to the chat as well, if that's something you'd like to just register for right now. And without further ado, I would like to introduce Dr. Natasha Trujillo, who will be presenting athletes and eating disorders. Dr. Trujillo holds a doctorate degree from Purdue University, where she specialized in working to address mental health needs and access with collegiate athletes. She's passionate about normalizing mental health in the athletic population and helping athletes become their best selves in and out of their sport. Dr. Trujillo joined EDCare in January 2021 as a primary therapist and the lead of EDCare's athlete program. She's reimagining this program and will be sharing a little bit more about the details of how this shows up at EDCare during today's presentation. So I will let you take it away from here, Dr. Trujillo.
Awesome. Thank you. Let me share my screen here. All right. Awesome. Erin, can you all see that?
Yes, it looks good.
Perfect. So I need to find the bar there. There we go. All right. So thank you so much, Erin, for the introduction and for having me. I wanted to start off by just talking a little bit about what to expect for the presentation. So we're going to be going kind of bouncing around a little bit, but we're going to cover these following topics. I'm going to be able to identify some signs and symptoms of eating disorders in athletes specifically. We're going to be talking a little bit about how to increase awareness of the factors within sport culture or the athletics world that often fuel the development of eating disorders. We'll talk a little bit about understanding how eating disorders can affect performance in athletes. And then we'll wrap up with talking a little bit about assessing for severity of an eating disorder with athletes, and then just some different considerations to consider if we need to be referring them to a higher level of care. We'll start off with some signs and symptoms of eating disorders in general. Later on in the presentation, we'll look at the criteria for each eating disorder, but we'll start with just some basic signs and symptoms for now. So what you might be noticing in athletes, you might be noticing a loss of period in women or in girls, chronic injuries, or athletes who are training when injured. So this could be repeated stress fractures, or if they have some sort of torn muscle or stress reaction, broken bone, but continuing to train despite recommendations suggesting that they shouldn't. A decrease in physical performance, so you might start to notice regression in how they're physically performing or psychologically, so potentially not remembering plays as well, small mistakes that they don't typically make, shifts in their mood, or changes in typical behavior. So again, this would require some level of understanding or awareness of each individual athlete, being able to kind of pick out what might be a little bit different or off. New or increased conflict. Oftentimes you might see more conflict with teammates, more conflict with coaches, or with outside family or people in their lives. You might start to pick up on true obsessions about training routine or a body image. So being very focused, very rigid about how they time their workouts, what that looks like, or even body image as well. So you might hear them start to talk more about being fit or being more toned or more sculpted or more this or less this. You might start to see physically, right, some stark changes in weight or body shape. Especially in collegiate athletics, we see this a lot, but voiced concerns from others. So oftentimes eating disorders are picked up not because the athlete themselves comes to us, but because teammates or coaches or just other people in that athlete's life are expressing concern and noticing symptoms and kind of putting those athletes on our radar. And then lanugo as well, which is hair growth. So let's talk a little bit about healthy versus unhealthy exercise and how this might be connected to some of those signs and symptoms. With healthy exercise, you are going to be you're going to be utilizing it for the following purposes, right? So it's intended to promote health or well-being. Recommended weight and health are actually sustained during repeated exercise, so you're not seeing a lot of stark changes in weight or in health. Exercising with peers or in social situations, quite healthy. Having a little bit of flexibility, maybe some spontaneous exercise, more of a balanced routine. So maybe you're doing some cardio, maybe you're doing some strength training, maybe you're doing some kickball or softball with friends. It incorporates fun and relaxation. Again, flexibility, freedom, and choice in what type of activity is being done, and it tends to align with the person's values. On the unhealthy side of exercise, it's basically, right, the exact opposite of what I just went through. So significant time spent prepping for exercise, engaging in exercise, and recovering from exercise. Oftentimes we'll notice that decline in performance. A lack of interest in other activities. So like I was saying earlier, some true obsession around workout schedule, how to fit it in, maybe getting rid of other things to make sure that they can fit that workout in. A very rigid or obsessive routine. So again, just lacking that flexibility, not necessarily going to exercise with peers or do an activity for fun, but saying, no, today is Monday, I have to do my chest workout. It has to be 50 minutes long, and then I have to follow it up with 3 miles of running with no flexibility in between. Continue training with injuries and fatigue, like I had said earlier. Self-worth being determined by exercise. So not feeling okay if you don't get your workout in for that day, right? Something is wrong, the whole day is off. And then also some potentially problematic social media use to conform to an ideal exercise routine or to post all of your workouts or to derive a lot of satisfaction from workouts. And I threw in this arrow here because there really is a catch with some of these unhealthy patterns of exercise. And that is the fact that on this continuum of activity from people who are very sedentary and sit pretty much all day, every day, to the other extreme, which is really unhealthy levels of exercise, athletes really do kind of fall in that middle ground between physically active and unhealthy levels of exercise. Going back to this table, right? So a rigid or an obsessive routine, especially high performance athletes, college athletes, professional athletes, they do have a pretty rigid and obsessive routine. It's kind of designed that way. There is significant time prepping for exercise, engaging in exercise, and recovering. Oftentimes continue training with injuries and fatigue. And then even that self-worth piece, right? Depending on the athlete's identity, and how strongly connected they are to that. So that leads us to talk a little bit about sport culture norms, and how some of, right, this continuum kind of comes to life and reinforces some potential for eating disorders to be developed and maintained. So sport culture norms, broadly speaking, they can be quite psychologically healthy, but athletes do tend to eat in unusual ways, especially at a high level. Most high-level athletes do attend pretty meticulously to diet and weight. It's something that they monitor frequently. It's talked about frequently. You might see athletes weigh food before meals or measure food before meals. They might avoid certain food groups altogether. I was just talking with an athlete yesterday who would do anything possible to avoid any sort of refined carbs. They might plan incredibly carefully for their meals too. So really mapping out what they're going to eat each day. If they're going to go out to eat, obsessively looking at menus beforehand, trying to plan what they can or can't do. Weighing self and measuring body composition regularly as well. I've worked with several athletes who would actually travel with a tape measure and would weigh or would measure certain parts of their body and weigh themselves to make sure that they're kind of staying in line. And this was seemingly quite regular and quite normalized on their team. There can be then some pathological behaviors that start to develop as a result of that, right? So athletes can begin to exercise beyond their normal training load. So they're trying to sneak in a few extra workouts, maybe before practice, maybe staying after practice. They might be increasing their load again without a clear goal. So what is the motive? What is what they're trying to achieve? You'll also start to see this belief that happens where it's like more is better. The more I train, the better I'm going to be, without attention to what that's doing to their body. This is often done secretively. I've worked with several athletes who are getting several extra workouts in throughout the day and are very careful not to share that with coaches or trainers, especially if those athletes are injured. You might see them engaging in extreme or fad diets without a clear goal. There was definitely a bit of a contagion thing a couple years ago with vegan diets, and I've seen also teams want to cut out carbs completely. And then of course those typical eating disorder behaviors, which we'll get into a little bit later. Wanted to throw out a few stats as well. Eating disorders are one of the most common mental illnesses in elite athletes. Rates vary from a research perspective, 0 to 39% in male athletes and anywhere from 6 to 45% in female athletes, and that is across the lifespan. So that could be, that's all grouped in high school, collegiate, professional, semi-professional, etc. Among high school athletes specifically, ED prevalence is higher among athletes than non-athletes and higher for females than males. You can see some pretty stark differences between those percentage rates there. Increases the risk of REDS, which we'll talk about here in a little bit. And then again, eating disorders are maintained by perpetuating factors such as approval by the coach or significant others, teammates, the physiological consequences of starvation or initial success as well. So oftentimes we will see an athlete who becomes more lean, does start to lose some weight, is engaging in eating disorder behavior, and does see an initial success or increase in performance, which obviously perpetuates that. Also, some of the patterns that I just talked about too, with overexercise or overtraining, showing this interest in wanting to do more and wanting to be better, can get significant approval by coaches. There's a lot of reward that comes along with that in the athletics world, which can be the breeding ground for an eating disorder too. So I want to get into talking a little bit more about sport culture specifically. So on the left-hand side here, I do have just some general risk factors for eating disorders. I'm not going to spend too much time on those. But the sport-specific ones, one of the biggest is having an early start in sport or an early specialization in sport. Working with an athlete right now who began running probably about age 7 or 8, and was sent messages really early about the way that their body needed to look, and encouraged to postpone puberty as much as possible in order to remain a good runner. So that early start can really, really impact things. The sport type can very much impact this too. Weight class sports do often come with frequent weight cycling. I've worked with a lot of wrestlers who have to cut extreme amounts of weight after being out of season for a little bit, or they get moved down or up a weight class and have to really make that work in a very short amount of time. So there are certain sports that fit into that. Traumatic sport events can very much trigger or be a risk factor for eating disorders. So injuries can be huge, especially if an injury has someone being fairly sedentary for a while or requires surgery. Sometimes significant losses. So the loss of a championship game, with COVID happening, the loss of a year of eligibility, for example, academic things that might impact a sporting event, other life circumstances that might pull an athlete from a sporting event. Undesirable body changes, injury or otherwise, right? So injuries, pretty self-explanatory, but there are other types of body changes as well. I have worked with several collegiate athletes who, in their transition from high school to college, built a lot more muscle once they started being in the strength room, or in the weight room more often, and recognizing, okay, I look great for my sport. This happens very frequently with female athletes, feeling like they have more definition, look good, feel like they can perform good in their sport. And then when they hang out with their friends, family members, whoever in their life who isn't an athlete, noticing those stark body changes can do a lot to body image in general and mental health, self-esteem. The team environment can be a huge risk factor as well. So both coach and team influence. So what do coaches say about fitness? What do coaches say about what in shape means? What do coaches say about strength and conditioning? And what does the team do? Again, I've worked with several athletes who there was kind of some unwritten rules about, not only unwritten rules, but also unsaid competition about who could eat the less and run the farthest, for example. Team uniforms can be a risk factor depending on how tight they are, what is showing, how it shows certain parts. I have an example of Brecken Willis, who was a collegiate swimmer who was disqualified because of the way that her suit fit her body. Seasonal status can also be a risk factor. In season, out of season, pre-season, how does that impact how they're fueling, how much working out they're doing, and how that impacts body image, that sort of piece. Performance level. So again, are they an Olympic athlete? Are they a collegiate athlete? Are they a injured collegiate athlete? Are they a redshirted collegiate athlete? And then overtraining, of course. I want to break it down just a little bit more into the sport type. So sport ideal, right? Perceptions and reality. So what does an athlete feel like a successful athlete in their sport looks like? There's all sorts of perceptions about that. Again, having a conversation with an athlete yesterday who was talking about leanness. Leanness is key. You can only perform well if you are lean. So such a strong perception tied to that. And the reality of some sports. We do know, for example, with a sport like rowing, weight matters. Wrestling, you have to make weight, it matters. So there's some realistic pieces that very much contribute to the anxiety and the stress and the pressure that these athletes feel. But there are also some perceptions about success can only occur if I look this way or if I perform this way. There are also high risk sports, okay, for eating disorders, things that where we're going to see just some higher rates. So some lean or endurance, so running, aesthetics, gymnastics, power to weight or anti-gravity sports. Again, those weight categories, anything where you're being measured. And then of course, high intensity sports. So alpine skiing, for example. There's seemingly lower risk sports tend to be ball sports. There was a recent study, I believe it's 2012, 2013, that did not show any significant differences between ball sports. I want to talk a little bit about how gender identity plays a role in this, and I do have a note on inclusivity here. In looking through a lot of the research, unfortunately, it really is still based on that binary female to male. I have not come across a lot of research that studies, for example, trans or non-binary athletes, so I just want to give a little note there. For female athletes, they are considered a high risk group for eating disorders because of the unique sport environment. There are pressures about weight, about eating, about appearance, and about performance. So kind of going back to the uniform piece, coach making comments about weight. I worked with a collegiate team where it was actually a soccer team, and they were weighed every other day in front of the rest of their team, really for no good reason, but really sent a message that weight mattered to that team. And we saw a high rate of disordered eating on that team as well. Highest prevalence among female athletes does tend to be in the endurance and aesthetic sports. Really interesting study, after over 2 years of active competition, rates of eating disorders increased from 15.3 to 20.8%. So again, going back to that early specialization in sport or length of sport, oftentimes the more that an athlete is submersed in that culture and continues to specialize and strive to be good at their sport, we can see some increased disordered eating or eating disorders result. Retiring from sport is also huge. So overall percentages there increased from 18.7% when competing to 26.9% when retired from sport. So much transition happens when an athlete is retiring from sport. You have the loss of that identity. You have your schedule completely changes, right? You really have to figure out who else you are outside of an athlete, and you're not working out as much. You're not training in the same way anymore. And so we can see an increase in eating disorders there. Then there's also, again, distress just related to the body composition changes post-retirement. So again, loss of muscle, could be some weight gain or weight loss depending on sport. And that's going to impact self-esteem, body image, self-worth, a lot of different pieces there. On the male athlete side, looking through a little bit of research, current research does indicate a pretty high prevalence of disordered eating and eating disorders with a wide range of causes for male athletes. Eating disorders do appear more frequent in male athletes compared to non-athletes. Most frequently associated factor on the male side is participation in those weight-sensitive sports. So your wrestling, your boxing, anything where you have a weight class. In adult male athletes, eating disorder prevalence rates up to 32.5% were found. And prevalence was not necessarily higher in young or adolescent male athletes, which again speaks to that length, that early specialization sport, and that length of stay in your sport. Some suggest some potential gender-specific risk factors in the literature: drive for muscularity, steroid use, LGBTQ plus community, and then just gave you a little breakdown there of some of the sports that we tend to see higher rates in. So cycling about 50%, gravitational sports about 24%, weight class sports and about 18%. There's also an interesting study done on male jockeys who showed pretty high rates of low bone mineral density compared to other athletes and non-athletes. Another important piece here, psychological traits. And what just gets really tricky here is that some of the traits that are really desired by coaches in their athletes are also traits that can create really strong eating disorder as well. So coaches, again, will reward and look for things like excessive exercise, perfectionism, right? An athlete wanting to perform and perfect their movement, over compliance. So someone who is maybe putting in a few extra shots after practice or running a couple extra miles after practice. High achievement orientation, an athlete who shows that they want to be the best, that they want to win. And then, of course, even some obsessive compulsive tendencies. So again, wanting to meticulously attend to and follow through with a certain drill over and over and over again until perfection is achieved. So yeah, these traits are commonly associated with eating disorders, and they are often pretty essential for successful competitions as well. There was a study done in 2020 where perfectionism was found to be a central confounding factor in the relationship between eating disorders and athletes. So again, when we speak to the sport culture and what's normalized in that culture, we can see why eating disorders can become or can develop at such high rates. Okay, I want to switch gears here a little bit just to talk about eating disorders and performance. And I'll also throw out here that I'm not a medical doctor, so I do have some medical components here that I'm able to glean for the research, but I would always default to my either psychiatrist or medical doctor, PCP, or sports med doc to really get into the nitty-gritty of some of these pieces. But in general, we can talk about overtraining syndrome, right? So that is a condition that manifests when the volume and the intensity of an individual's exercise exceeds their capacity for recovery. Oftentimes, in time, athletes' performance and progress, they will start to lose some strength and some fitness. And again, several of those other signs and symptoms will start to emerge. So it could be changes in body composition, mood, irritability, obsessing about eating or body image, etc. I threw in a couple of things here that just speak to some of the different mechanisms that can be deteriorated as a result of overexercise or overtraining. So glycogen depletion can cause a premature reduction in physical, psychological, and mental capacity. Muscular pain, of course, can result. Dehydration can trigger muscular cramps, which we see quite often. And then, again, loss of lean mass can provoke that reduction in muscle strength and aerobic performance. So we'll start to see some true differences in how they are able to perform. Another interesting study in 2013 spoke to purging and how that can have a negative effect on sport performance too, just through dehydration and low potassium as well. So let's talk a little bit about REDS. REDS, basically, easiest way to put it is when an athlete doesn't have enough caloric intake to support what they are putting out. Without enough energy, health complications and a decline in performance may arise. And so you can kind of look through the graphic there and you can see all the different systems that can be affected by REDS. And then we see this little triad too, that gray triangle there between menstrual function, bone health, and REDS, which we can talk a little bit more about. But again, the main thing to take away from REDS is that when an athlete is not getting enough caloric intake to support what they are putting out. So they are under fueling and overperforming. Not going to spend too much time on this here, but did throw up a list as far as some of the medical complications of eating disorders, what can go awry. So I know when we are working with an athlete here at EDCare, we will often do a series of lab work. We will do bone mineral density tests and whatever else we need, sometimes EKGs, to get a good feel for any of these potential concerns and see what's going on so that we can help the athletes stabilize medically first and foremost. So this breaks down, there's a little video here, which I'm not going to play just for time's sake, but this really breaks down what the female athlete triad is. So again, speaks to menstruation. When REDS is occurring, there is irregularity. It can be a full absence or irregularity of your period. low bone mineral density, so we can start to see osteoporosis develop. And then that energy piece too. When REDS is occurring, there is just reduced energy, very, very low. They are just struggling to get through workouts. And this is something I hear quite regularly with my athletes here at EDCare, is they will speak to just feeling so fatigued, no matter how much they sleep, no workouts feel good, just very, very low energy. So here we talked through a little bit of the physiological consequences, but I also want to talk a little bit about potential performance consequences as well. And this is something that I have noticed coaches and trainers and even athletes tend to be a little bit more concerned about initially. And so sometimes this is a really easy way to start this conversation about REDS and give them some true performance markers that typically tend to raise their antennas a little bit more sometimes. So of course, that increased injury risk, decreased training, impaired judgment, decreased coordination. So again, speaking to those in the moment decisions. For coaches, that always becomes really interesting conversation, because if they're relying on an athlete to make a split-second decision when the game is on the line, and they recognize, oh, hey, this athlete isn't actually feeling enough and might not be able to make that call, that can kind of get them thinking and more on board with treatment at times. Concentration, irritability, depression, decreased glycogen storages, decreased muscle strength, endurance, performance. So this will typically get coaches and athletes a little bit more focused and wanting to work to restore health. All right, so moving into the last piece here. I won't spend too much time on this, but I did want to throw up the criteria that we use to diagnose eating disorders. So with anorexia, again, I won't read through everything, but just give you a few basics here. So with anorexia, we're looking for significantly low body weight by restricting food intake, usually is accompanied by an intense fear of gaining weight or changing body shape. There is typically a distorted body image piece that goes along with this, an extreme focus on shape or weight, and a denial of the seriousness of the illness. Most athletes who struggle with anorexia that I have worked with will oftentimes deny, this is not going on, this is fine, there's something else going on, I'm just tired, I'm just stressed, things like that. Bulimia, so recurrent binge eating, objectively a pretty large amount of food in a short amount of time. The athlete will feel very out of control while they're eating and then use some sort of compensatory behavior. So it could be vomiting, laxative abuse, excessive exercise, fasting, similar to anorexia, and extreme focus on changing shape or weight. Binge eating, recurrent binge eating episodes, so eating large amounts of food with a perceived loss of control, usually associated with a few different things. So it could be eating much faster than normal, eating until uncomfortably full, eating large amounts of food when not actually physically being hungry, eating alone due to embarrassment. So it could be a lot of negative affect that comes up as well. And then just a few others here, won't go through all of them, but a couple that I would like to draw attention to would be orthorexia. So in the OSFED category there, that is a truly unhealthy obsession with healthy eating or with clean eating. So I had talked a little bit about kind of fad dieting earlier, and we see this with a lot of athletes who will slowly start to cut out food after food after food and becomes very rigid. I can't cook with any oil, or I can't eat any sort of white rice, and it becomes smaller and smaller so that they're only able to eat a few certain things. Again, so not at all concerned with quantity necessarily, but that's all about food quality. And I think I will kind of breeze through the rest here. I think another interesting one for athletes is diabulimia as well. So diabetics who will intentionally omit or manipulate their insulin intake in order to manage their weight. I did work with a wrestler once who struggled with this, and that was a because of the potential medical complications as well, when you're thinking about the athletics world, and if an athlete is even healthy to compete, can bring up just some really challenging, just a lot of uncertainty, a lot of challenging predicaments that the whole team really needs to be aware of in making decisions for whether or not an athlete can compete. I want to look a little bit beyond the diagnostic considerations, beyond the criteria to be diagnosed with an eating disorder too. So again, just things to kind of pay attention to in these athletes. Are you noticing a low energy availability? Are you noticing that the athlete is more pale? Are you noticing that they are reaching out or needing more breaks, or, you know, kind of have their hands on their knees more, bent over a little bit more? Are they behaving in a way where they are having some pretty pathogenic weight control measures? Are they taking laxatives? Are they restricting? Like, what are you noticing about some of their behaviors to try to control their weight? Are there behaviors that are a little bit transient and might be associated with the demand and with seasonal status? So do you notice more disordered eating happening during a season, or maybe the month prior to season starting? I know a lot of athletes are always concerned about strength and conditioning and getting back in shape and passing those initial tests to be able to be cleared to compete with their team. Again, emotional and psychological state, performance concerns. So this could not just be, you know, maybe an athlete frequently was in basketball, for example, maybe they were frequently making layups, and, you know, you could always depend on them to make those immediate shots down in the key. And then for whatever reason, suddenly they're airballing from 2 feet away, or they're making decisions where they're wide open, but they're passing to someone else instead. So what's happening from a cognitive and from a physical standpoint with performance? And then again, thinking about sport types. Interesting thing here with lean sports, it's part of the culture. Disordered eating is part of the culture. So I'm thinking about running, for example, or triathletes. When menstrual dysfunction occurs, oftentimes it's either celebrated or it just seems very natural. And there isn't a lot of worry or concern. It's kind of like, oh yeah, you're doing what you need to be doing. So there isn't necessarily concern about competing. With non-lean sports, that can be a little bit different. For example, if on a basketball team where disordered eating might not be as common in a sport like triathlon, it could be recognized more quickly as problematic. So really looking at the sport type and some of the cultural norms for each sport can contribute a little bit to what might be seen as problematic versus not problematic, but is great for us as clinicians and mental health providers to really pay attention to in diagnosing. Maladaptive use of exercise. So there's a bunch of terms, different ways to say this, but basically what it's all getting at is over-exercising or using exercises in an unhealthy way. So again, going back to maintaining that rigid exercise schedule, I have worked with several athletes who, if they don't get up and work out at a certain time or don't have the exact same set of exercises, their whole day is thrown off. Feeling distressed if unable to exercise at all. So again, maybe planning family vacations around, well, where is the gym going to be? When am I going to be able to do this? I can't take a plane ride during this time because this is when I typically work out. Again, tolerating very repetitive exercise routines, and then obsessing about numbers too. So you might see some athletes constantly, and there's so many apps and watches and things like that at this point, but really focusing on heart rate or how many miles they've walked or how many calories they've burned, and actively speaking about this. You might see them just checking it indirectly, but then also actively speaking to teammates or coaches or parents about what their data is saying. Other interesting piece here is trying to tease apart athletic pursuit versus maladaptive exercise. So having conversations with these athletes, what is the value of their sport or of exercise? So asking why they engage. When I first start working with an athlete, that's always one of my first questions is, why are you doing your sport? What are your goals? What are you trying to achieve? Is it more of an internalized goal, right? Like, I want to be the best, I'm doing this for me? Is it a goal that's like, well, you know, I have to make it to the league. I have to make it to the league because I have a lot of family that are counting on me, and my financial stability in the future depends on my family's well-being. So why are they in sport? Also being able just to kind of check in about what sport in their life looks like. Do they have recovery days? Do they ever have an off season? What does an off season look like? And then again, the intensity and the volume of what they are doing. How long are they training? How often are they training? How hard are they training? Unfortunately, with this, you will see a lot of athletes who tend to fib, or they kind of know what they think coaches want to hear, and so they will try very hard to kind of hide some of the more secretive pieces. So it can be a little challenging to tease out the truth sometimes. Treatment considerations, I think a huge one here is getting coaches on board. This is Coach Collins. He's one of my closest coaches that I've worked with over the years, so always like to give a good shout out to him. But getting coaches on board is crucial. So for us, what does that mean as mental health professionals? Understanding that athletes are a special population. They do have unique aspects of the work that they do in and out that contribute very significantly to eating disorders. Understanding the importance of sport in their life. Sometimes it is their livelihood. Sometimes it is their job. It is how they get paid. It is how they go to school. Understanding the importance of sport in the life of their coaches as well. So really getting a feel for what that sport culture is for them. Understanding the power and the influence that coaches have over their athletes. The coach-athlete relationship becomes incredibly important to be able to understand. Recognizing the importance of talking to coaches through a performance lens. So this is something that I am still continuously working on, but being able to recognize and share my concerns for an athlete's mental health, but pitching it in a way that gets a coach to understand that it can impact performance. Because at the end of the day, right, they have a job and their job is to win. So just, again, subtle ways to kind of change your language to get coaches more on board. Recognizing that their athletic team is absolutely their family away from family. Becoming familiar with recommendations by different sport governing bodies, so NCAA, USOPC, Safe Sport, depending on the level of performance, the type of athlete that you're working with. And then remembering that coaches are people too, so facilitating that relationship. I feel like I have to do just as much work with an athlete's treatment team, so their trainers, their coaches, their dietitians, as I do with the athlete themselves. The athletic identity requires a little bit of talking about as well. So really just understanding and appreciating the culture and the temperament that goes into creating elite athletes. Recognizing that most athletes do perceive weight loss or weight control as performance enhancing and vital to their sport. And I would say pretty much across the board with any sport there. Thinking about removing an athlete from sport, you are removing their support network and you are compromising their athletic identity, which can be a traumatic event in itself. I know that when athletes are pulled from sport and enter treatment here at EDCare, there's significant grief and loss that usually needs to be dealt with there. And then again, just keeping in mind, recalling what the ideal athlete is from an identity standpoint. So they might excessively exercise, they're a bit perfectionistic, could be overly compliant, tend to be high achievers, and tend to have some obsessive compulsive tendencies. And then of course, along with high levels of pain tolerance too, which speaks to athletics culture. You gotta be tough, mental toughness, you fight through pain, no gain, things like that. Another treatment consideration, how do you return an athlete to sport after a period of stabilization or treatment? So as you resume activity, paying attention and checking in with the athlete. Are they using training and competition to diet or to control weight? Are they actively participating in treatment, whatever that means for them at the outpatient level? Are they supposed to be meeting with a therapist, meeting with a dietitian, etc.? Are they able to maintain expected body weight? They can compete when that goal weight has been met. Are they complying with their meal plan? Are they medically stable? Are they able to refrain from eating disorder behaviors? And again, you can start to kind of gradually increase their participation as the behaviors remit, and then help them ensure that they are relying on new coping skills as their stress levels increase, because it's not going to be the last time in their sport that they're going to be challenged or be concerned, or be triggered to potentially fall back into the eating disorder as well. And then typically just kind of keeping in mind that if you notice significant weight loss or just non-compliance with the plan that you have in place, making sure that athlete knows that they will be withdrawn from all activity and will be encouraged to focus again on their recovery more than on their performance. So for the last few minutes, I'll talk a little bit about our approach here at EDCare. So we have specialized assessment and treatment for high performance athletes. So we work with collegiate, professional, semi-professional, Olympic, Paralympic athletes. Our attention, we are really focused on interrupting the eating disorder with a goal of returning to sport and performance, but really wanting to put their health and their well-being first. So of course, we want them to return to sport and thrive, but we want them to be okay as human beings first. And then we have a pretty comprehensive and collaborative team to address, again, that whole person, not just the athlete and not just the eating disorder. So we have involved, we have the athlete, we have the athlete's team. So we'll invite trainers, coaches, dietitians. If they're working with an outpatient therapist, their family, it could be significant others, it could be parents, siblings, counseling and sport psychologists, which is myself. We have a mental performance coach on board, which helps with training. We have a dietitian who handles all meal planning. We have a psychiatrist who is in the process of becoming a sport certified psychiatrist. And then we have, of course, a physician to handle all of the medical pieces. And then we also have a strength and conditioning coach who steps in once the athlete is ready to return to training, is able to oversee those things. And then we also have family therapy as part of our team as well, which is usually done with the athlete's family of origin. So their caregiver, their parents, their caregivers, siblings, significant others, etc. Our treatment model, I won't spend too much time on this, but we do tend to follow a biopsychosocial model. So paying attention to the biology, physical health, potential genetic vulnerabilities, drug effects, psychological pieces. So coping skills, social skills, what is their family relationships like, self-esteem, all aspects of mental health. And then social aspects too. So what is their interpersonal dynamics and how could that be potentially contributing? And then we add the sport piece on top of the biopsychosocial. So recognizing, again, when you leave sport for treatment, there's potential trauma that comes along with that. We are interrupting exercise. We are interrupting their entire routine. And then, of course, paying attention to sport culture and the different experiences that they have had as part of their treatment. We can't really separate that when we're treating them. Assessment process. So this is how I assess a potential athlete. So I'm kind of looking at number of hours dedicated to training. Do they receive funding and benefits? Because that speaks to, again, their athletic pursuit. And why are they pursuing? Is this goal driven? Is this financially driven, etc.? What is their buy-in for putting recovery first and returning to sport secondary? Are they willing to take some time away from sport initially? How does their eating disorder serve them in their sport? So this is an initial consultation that I'll have just to get a little bit more information to see if they're a good fit for our program. Typically have patients admit at the PHP level, and they get assessed by myself, psychiatrist, physician, dietitian, family therapist, strength and conditioning, so a lot of different assessments. And then they move into treatment, which is a lot of group therapy, a lot of individual therapy with all of the people mentioned above, and of course, meal support. And then over time, as we start to see some progress, we will talk about return to training and what that could look like. We have some groups that are specific to our program. So we have a mental skills group, which is very much focused on performance enhancement, not just in sport, but in life as well. We have an intersectionality and sport culture group, which helps the athlete look at their culture of their sport through a more critical lens and think about rules and assumptions and beliefs that they have internalized throughout their time as an athlete that might be contributing to their eating disorder. Athlete body image. and then return to sport / return to life. So again, helping them, really looking at the eating disorder as an injury and helping them figure out how do you transition back into sport. We also do some potential career counseling and just pieces that help them return to life as well and look at other aspects of their identity. We have, of course, our dietitian, some nutritional considerations for training decisions and what that looks like. I won't spend too much time on that. And then again, the training reentry process. So they do need to be far enough along in their recovery process. They need to be medically stable. And we get this from a variety. So we've got the objective labs and support from our physician, but then we also just look at how they're doing in treatment, how engaged are they in the process, how open are they in therapy, what changes are we noticing, so we can kind of put the subjective and what we can gather objectively together to determine what that training process will look like. We do pair workouts with mental skills training as well. So our mental performance coach travels alongside the athlete, trains with them, checks in about eating disorder thoughts or behaviors while training, just to, again, give some extra support and ensure that we are really seeing the progress we think we are seeing as we gradually get them back to training. After EDCare, we do our best to ensure that their outside team is aware of the step down plan. We actually have their team be part of treatment the whole time through, but really wanting to make sure we secure a good dietitian, outpatient therapist, that sort of thing, so that they know that they have support as they leave our more intensive support. And then we discuss recommendations, right? We're always putting the person first and the athlete second. We're encouraging people to take warning signs seriously, talking about that, hey, if you start to see some non-compliance, you need to withdraw. What can you do there? We try to emphasize health risks and de-emphasize number on the scale, and then promoting and modeling a positive self-image, and then providing additional resources as necessary for each individual athlete. Erin, do we need to move to Q&A?
Yes,
Okay.
yes, we have some questions coming in. If you feel like this is a good stopping point.
Yeah, that's
that was
perfect.
absolutely wonderful. Thank you so much. And to just jump right into questions, one individual is wondering what would trigger you to encourage clients to get a bone density test?
So yes, typically, so you can start to see some stress reactions, so a decline in performance or an athlete complaining of pain, or you might see, a lot of times they won't complain of pain, but coaches can just see, hey, they're running on that a little bit different, or they're overcorrecting, or maybe using the other side more. So again, you can sometimes see it behaviorally, and then I think it's just kind of protocol at this point. We just want to kind of see where they're at. If we're noticing major changes in weight, just really want to get a baseline for where they are and see how much potential damage. Again, I think when we're assessing for REDS too, looking at how, if osteoporosis is already there, for example. So we just want to get a good feel and a good baseline to see if anything is wrong, so that we can be aware of that from a medical standpoint as we start to treat the athlete.
Thank you. Another person is wondering if you found that athletes have shame and are resistant when their treatment team involves so many people.
It depends on the athlete and the relationship they have with their athletic department or athlete team. Surprisingly, most athletes are like, yeah, let's make sure these guys know where I'm at and what I'm doing. And they do seem to pretty easily welcome people in. Of course, you're going to have some athletes that are like, head coach, absolutely not going to know anything, not going to do that. But for the most part, yeah. And I think when we speak to the value of that and how each member of the team can contribute to their support, or to support them and to their success, there tends to be pretty good buy-in.
Thank you. Do you see a connection between weight-related sports such as boxing and insomnia? If so, how do you differentiate that between tiredness from lack of sleep or from eating disorder behaviors?
Yeah, I think that's really challenging in general, because fatigue is huge. When I was working in college athletics and just doing annual mental health screenings, fatigue was consistently a huge concern. Even thinking about circadian rhythms and when young adults in particular tend to perform best, it usually is late afternoon to evening. And most athletes are getting up between 4 and 5 o'clock to go to practice or to go to weight training and things like that. So I would argue that basically all athletes are pretty sleep deprived. And so it can be really hard to tease out, how much is an eating disorder, how much is insomnia. So I think part of it is really getting a feel and doing a pretty thorough sleep assessment with each athlete to see what are their patterns. When are they having trouble falling asleep, staying asleep? Does that vary in season, out of season? Does that vary when practice is 2 a day, 3 a day? So getting as much information as you can there to kind of help tease that out. It is not easy to do though.
Are there any diagnostic assessments that you like to use specifically with athletes?
So that's actually something I'm looking into right now. I'm really trying to just peruse the literature and look for different ones. I don't have a specific one that I use regularly. Honestly, I think I'm just too new to using the screening tools and seeing what's out there, but that is something that I'm actively working on right now. The FAST questionnaire is the one that comes to mind that I see and hear about the most frequently, but I don't know that I have a solid one that I would recommend at this point. But that is mostly due to, again, still perusing and trying to figure that out for myself right now.
Yeah. So another individual is wondering, I think this will be a good one that you can speak to. How have you dealt with coaches who are resistant to change or continue to perpetuate the unhealthy culture on the team?
Oh my gosh, yeah, that can be a whole talk in itself.
Whole presentation.
It is so challenging because you want to maintain a good relationship with that coach and you want to build trust with that coach. And I think that is the foundation to answer your question. Because the more buy-in you have from coaches, the better. And so I think when I'm able to build a relationship with a coach and to slowly start to throw in some advice and some recommendations, the stronger my relationship is with that coach, the easier it gets to be able to provide some more solid feedback. Sometimes you can also go through assistant coaches or strength and conditioning coaches and have more of a united front. So again, that's just kind of knowing the dynamics of a certain coaching staff. Because I know, for example, with one coaching staff that I worked with, I knew that one of the assistant coaches was going to be way more benefit having that coach approach head coach more than anyone else would be more effective. So you kind of have to know some of the dynamics there as well too. I also think sometimes you have to be willing to, I'm talking about the relationship, right? But you have to be willing to risk a rupture in the relationship as well, and just sometimes say like, look, this athlete is in trouble and this is what I'm seeing and this is where they're at and I need you to be on board. I need you to stop talking about this athlete's fitness. I need you to stop saying that it's a good thing that this athlete hasn't had her period in 4 years. So sometimes you just have to kind of risk it and go with it. I have found even in those moments where I've had to have some tough conversations, for the most part, I've been able to repair and move forward. But again, just it's challenging and you really have to balance building that relationship and having them trust you with also knowing when you have to do what's right for the patient and say something that the coach just might not want to hear.
Yeah. Hard conversations all around, but always in the best interest of the athlete. So another individual is wanting to know what the predominant sport is that we see here.
That would be track and field, triathlete, any sort of like lean endurance running, I think is what I've seen here most frequently.
Okay, thank you. And another individual is wanting you to speak a little bit more on prevalence of orthorexia and how much you're seeing that in patients.
Yes, I would say it's starting to become more common. I have noticed it, maybe this was probably within the last 3 years, I would say, starting to see it a little bit more and more. You'll also see documentaries come out. I can't remember the name of it, but there was a documentary on athletes who are vegan that I want to say came out on Netflix maybe like a year or two ago. And so you can have some of those fad pieces too that athletes will kind of latch on to. So I think it is becoming a little bit more increasingly common. And I think social media does not help with that too much. Some of the activities that we'll have athletes do in our groups here is start to look through social media or look through magazines, and every headline is, you know, you don't want these proteins, you want these proteins, you need to avoid these carbs, but eat these carbs. So there's just all these messages about what we should be eating, what we shouldn't be eating, right? Egg whites instead of eggs, and athletes can just slowly fall into that and really begin to cut things out. So we do see it more. I've seen it increasingly more the longer I've been in the field.
Thank you. Perhaps just one more question and then we can wrap up. Is there a specific length of time that you ask athletes to abstain from working out?
That is a great question. So there's no hard and fast answer to that. And that's always an athlete's first question is, how long do I have to not train? Or I have to start training. I can't even take time off. I have to train while I'm there. So typically how we go about those decisions is, again, objectively, we gather as much data as possible. So checking labs, BMD, things like that. And then we kind of make that determination as well. Sometimes the decision has been made for an athlete and they've already been pulled from their sport in their collegiate environment or within their Olympic sport. So that makes it a little bit easier for us. So we do not have hard and fast rules. We also need to assess a little bit for how committed and engaged the athlete is to truly doing work. And I don't just mean mental health work. Are they completing their meals? Or are they refusing meals? Are they completing a little bit, but choosing just to boost for the rest of their meals? So we really just try to take as much subjective and those objective markers into consideration so it does look different. I've had athletes who haven't exercised, for a month, maybe 2 months. And I've had some who have taken absolutely no time off, have come into the program training with us too.
Thank you so much, Dr. Trujillo. And thank you everyone who joined us today. Just a reminder, the evaluation will pop up as soon as you exit out of the Zoom webinar. Please make sure to indicate on that whether you need a continuing education certificate or not. And we will have those processed and emailed to you by late next week. We'll also be sending out a recording of this presentation. And should you have any other questions, I did put my contact information in the chat. Please email me and I will connect you with Dr. Trujillo or admissions or answer any program related questions myself. Thank you all so much for joining and have wonderful rest of your day. Thank you.
Thanks.